California officials are urging preventive measures to thwart the spread of respiratory illnesses and alleviate a health system already contending with the triple threat of COVID-19, influenza and RSV. For weeks, public health leaders across the most populous state have sounded the alarm about the challenges posed by simultaneous circulation of the three viruses. With Thanksgiving and the rest of the holiday season around the corner, ways in which residents address these health challenges can help chart the state's course through the next few months, officials say. We are dealing with three threats at once, California Health and Human Services Secretary D. In every category that we track, whether it's test positivity, case rate numbers, wastewater surveillance, clinical surveillance, hospitalizations, we're seeing increases for RSV, flu and COVID. Of particular concern is RSV, respiratory syncytial virus, which can cause significant illness and death in young children and older people. It has struck with a vengeance, sickening so many children that some hospitals have reported running short of pediatric beds. We have seen an abrupt increase in all of our RSV cases, said Dr. Vidya Mony, a pediatric infectious disease specialist at Santa Clara Valley Medical Center. If you look at a lot of the curves, it's almost linear. So this is significantly more than we have seen in quite a few years. Compounding matters is the fact that pediatric hospital beds can be in short supply even in the best of times. Many hospitals have only a small number of pediatric beds, meaning that just a small number of new pediatric hospitalizations have the potential to put a hospital at capacity, Los Angeles. Orange County this month declared a health emergency amid a high level of RSV and other respiratory illnesses that required hospitalization of children exceeding the capacity and infrastructure of our designated children's hospitals, officials said. On Tuesday, L.A. County reported average daily occupancy of staffed pediatric hospital beds at 64%, up from 60% on November 1. For pediatric ICU beds, average daily occupancy was 75%, up from 67%. Both figures are higher than at any point in the last 17 months, according to Davis. These numbers do not translate to a dire situation at hospitals at this time, he said, but the increases in pediatric bed occupancy are concerning, especially given the fact that we are still early in the typical